One thing that we need to talk about is planned cesarean birth. Um, a few reasons why you might have chosen a planned cesarean birth would be a breech baby, um, multiples, twins or triplets. Um, if you've already had a cesarean birth, you might choose a planned cesarean birth for the second or third baby. And there are a few other various reasons, but those are usually the main ones that you hear about for someone having a planned cesarean. Basically, what happens, we'll kind of go through the process now of what you can expect as far as your planned cesarean. A few months before your due date, they'll give you a call and let you know that these are the times that are open for your OB to be there and to support you through the cesarean. You'll choose a time. You get to pick your baby's birthday, which is pretty exciting, and then you wait until that day. If you do happen to go into labor before then, you just let them know, and they'll obviously push you up and do the cesarean before your planned date. But otherwise, they'll give you a call and let you know that your planned cesarean is scheduled and it's in the next couple of days because, as a 37, 38-week pregnant woman, that's something that you're going to forget. Not really, but they'll let you know, that it's still good to go and that everything's scheduled. So the day of, you'll go to the hospital during that time that they've given you. Your OB will come in possibly to discuss things. Otherwise, you'll have a nurse that discusses, what's going to happen and kind of goes through the plan. You sign a bunch of consent forms, things like pain relief, antibiotics, things like that. What's going to happen to the baby? Do you want your vaccines right away? How's that all going to work out? If you have any special requests for your cesarean as far as a gentle cesarean goes, if that's something that you discussed with your care provider beforehand, you might have some consent forms to sign for that. You'll get all ready in your gown and get prepared. The anesthesiologist will probably come in and discuss how the anesthesia is going to go. The chances of them putting you under are very low nowadays. That doesn't happen very often unless it's an extreme emergency, but something like a epidural or a spinal block might be used. They'll bring you into the OR. They'll administer that pain relief so that they can, have everything there and have everything ready. A cesarean doesn't take a very long time once everything's set up. So they like to have you in the OR, get everything set up, get all their machines set up. They'll place an IV. They'll probably give you some antibiotics for recovery into your IV, and then they'll start, once your pain medication has settled and you feel like you are comfortable, they'll ask a few times, are you comfortable? How's everything feeling? They'll just begin the cesarean. They cut around the bikini line and they cut through, the tissue and the muscles until they get to your uterus. They'll cut your uterus and open that and then pull the baby out. Of course, this is obviously after they put the sheet up. If that's not something that you want, if you don't want them to put the sheet up, that would be something to discuss beforehand. I know a few hospitals in Kansas City do allow for a clear sheet so that you can watch the process of your baby being born, which can be pretty exciting, but that would be something to discuss beforehand. So they'll pull the baby out. They will usually suction the baby, make sure that the baby is turning pink and breathing and getting acclimated to the outside world, and then most of the time they bring the baby to you so that you can see the baby and snuggle the baby and go from there. A lot of times your partner can be involved at this point by doing skin to skin with the baby if the baby's healthy and if that's something that you've discussed prior. Otherwise, they'll probably take the baby into the NICU or into the warming area and do everything that they need with the baby there while you are getting stitched up. And then your partner can obviously go with the baby as long as it's not an emergent situation, they can go with the baby to make sure that everything is going well with the baby. They'll stitch you up and wheel you into the recovery room where your baby will probably be waiting for you with your partner, and then you get to enjoy your baby and hopefully recover, and it's a super easy recovery and everything goes well. They'll probably give you more antibiotics just to make sure that you don't get an infection. But something to look out for sure is infection in the cesarean cut. Um, Obviously, it's major abdominal surgery, and it's something that you need to be aware of, that could potentially happen. So they'll want you up and walking around as soon as possible, and your nurse will help you out with all of that. Yeah, and it can be, I mean, it can be a wonderful and healing experience for a lot of people who maybe have had a very traumatic either vaginal birth or emergency cesarean. And a lot of women really, they choose the cesarean for very specific reasons because it's very healing for them, and they feel like it's something that they can finally control maybe during if they've had a hard pregnancy, or that, I mean, there's a million reasons, but it's something to discuss with your care provider if that's something that's interesting to you. So hopefully it goes perfect and there's no issues whatsoever.